sites as celebrated as the Gower Peninsula, the first place in Britain to be designated an area of outstanding natural beauty. It's a land of unexpected riches, a feast for the eye and the taste buds.
I gather you've not had any breakfast, Tommy. You're not feeling unwell?
At low tide,
I've had better days.
Shot of this should perk you up.
Oh,
gastronomic delight. I'm told that
Don't you know to knock first? Close the door quickly. I suppose you've come for some more of these.
See you later. Kevin?
Howard, what are you doing here?
You invited me. The best practice mutual review?
Well, that's tomorrow, isn't it?
No, tomorrow you're inspecting the mill.
Ah, I seem to have got my days mixed up. Sorry.
Well, if it's inconvenient, we can reschedule.
No, you've come all this way. I wouldn't hear of it. Well, let's not waste any time.
Come on, Tommy. It's your favourite. What's the matter?
nothing.
Oh, why are you being like this?
Like what?
You seem half dead.
Cheers, Norma.
Oh, but it's true. It's several days since we last...
I'm just tired.
Yeah. Well, you need to liven up. You all do.
And this is where our residents come to socialise. We feel the integration process provides a healthy stimulus.
Would you like to come to my room? Oh, come on then.
Please, leave me be.
Oh, come on, Tommy. It'll do you good.
That's quite enough, Norma. What do you think you're doing?
Trying to breathe some life into this place?
There's always one, isn't there?
Sometimes more than one.
And I really wouldn't be worried if I were you. At your age, it's very rare to get this sort of thing. But if it's going to put your mind at rest, then let's have a look.
And that's where we'll be installing our new therapy suite next month.
Excellent. What's your patient feedback like?
So far, a satisfaction rate of over 90%. Marketing and IPA effectiveness awards.
You've really turned this place around.
The previous manager wasn't a great believer in discipline, that's the key. You can really do anything with the correct training and following procedure.
Show them who's boss, keep the troops in line.
Managing the practicalities.
Exactly.
I've always regarded you as something of a mentor.
I think it's more of a classic case of the pupil outstripping the master.
And this is our quiet room, where the patients can indulge in their own spiritual spaces. On second thoughts, didn't you mention something about wanting to check out our new accounting software? Howard?
Yeah, Mr. Lenton, from what you're saying and the symptoms you're describing, I think you've got nothing to worry about. Good. But perhaps I can reassure you. Whoa. Mr. Lenton, let's do it on the examination bed, huh? Just try and retain a little dignity. Sorry, Doctor.
Sorry about the disorder. We had a delivery this morning.
Have the disorder.
Oh, excuse me, Miss Hartley.
Could you come into the lounge?
What is it, Tommy?
Irene's had a bit of an accident with the waterworks. I couldn't find Janice.
Will you excuse me?
How are you today?
Could I have a word with you, Doctor?
I'm not a doctor.
Oh. Oh, I heard you were from that mill surgery place.
Yes, that's right. I'm the practice manager.
Oh, near enough. Ballpark area. The thing is, you see, that I haven't been feeling too clever just lately.
Look.
Some days I'm so tired I can barely drag myself about. And then others, like now, I feel all fizzy. What's that all about?
I really can't say. If you'd like, I can arrange for a doctor to come out and see you.
Today?
Well, I'm not sure about that.
It could be today.
Why the urgency?
Norma.
Ah, is that the lady who you were having the argument with?
She's my best friend here. Well, a bit more than that now. If you get my meaning. And just lately, you see, she's become a bit demanding. And there's only so much an old bloke of my age can take. Or give.
I see. Well, have you spoken to her about this?
She won't listen. Could you ever go at her?
Well, do you think it'd be more appropriate if you approached Miss Hartley about this?
Oh, you must be joking. She and Norma aren't exactly bosom buddies. It'd be much better if you were to talk to her.
Well, I don't...
You're just the sort of bloke that she'd listen to.
Well,
She's in room number 38.
I really can't...
Just down the hall, turn left. You can't miss it. You wouldn't need to say very much. Just ask her to ease off a bit on the rumpy-pumpy.
It's a bit early for lunch, isn't it?
11, sis. I thought we'd have a little snack.
This is a little snack.
I had some leftovers from dinner last night, my Asian extravaganza. It'd be a shame to see it go to waste. So tuck in. Surrender to your taste buds.
Looks like you're trying to feed the 5,000.
Here, take a bite. Let the yumminess explode in your mouth.
No, thanks.
Go on, you said it's good.
I don't like spicy food.
Oh, you must have had a curry before.
Yeah, I had one that really disagreed with me. Never again.
Would you mind if I took some home for Robbie? He really likes some meatbally things.
Oh, I've been meaning to ask you, has he shaved off his moustache yet?
End of the month. It's a pity because I've grown quite fond of it. Makes him look like a porn star.
Is that a good thing? Dr. Tyler, ever been tempted? A lot of women are very attracted by the butch bear look. I'd love to sprout a beard, just for the experience. How about you?
You what?
Have you ever grown a real beard? Chicken dance hack.
Look, it wouldn't kill you to just talk to her for a few minutes.
I can't help you. I'm not a counsellor.
Mr. Bellamy, something's terribly wrong here. I'm not sure how much longer I can go on. Please, will you talk to Norma?
Like I said, I can make sure a doctor visits in the next couple of days. I'm sure we can sort this out.
All right, but don't tell Rachel. Promise me.
I'm not sure this is appropriate.
Is there something else, Tommy? You know, I've always admired you as an effective manager. You remain detached. You don't allow yourself to be distracted by trivia.
I sound just like my mum. People always get us confused on the phone.
Well, I don't have that problem.
Are you telling me?
People used to think I was adopted. But I just used to talk like all my mates, you know. Drove Mum mad.
I bet. Oh! Jazzy's looking for you.
She lost her chance to make me Mr. Posh Boy when I didn't get into King Edward's.
Oh, did you fail all your exams?
No, it's just too thick. She gets a son with a Brummy accent who doesn't go to uni.
That's a classic example of the environment working on your personality, determining your future self.
I won't go that far.
Why not?
More like my dad. Must be in the genes.
That's such a load of nonsense. In the genes.
Says who?
If you ask me, nurture trumps nature as far as personal development goes.
Well, I thought it was the other way around.
I think it's half and half, you know, a bit of nature, a bit of nurture, interacting with each other.
You listen to yourselves. Hell, what the hell do you know? You're just nurses.
Right, so our opinions don't count.
Not when it comes out as uninformed drivel, no.
Come in, Edna. Ooh, you still here, Mr. Suited and Booted? It's not what you think. Therefore, my blood pressure, I like to crush the pills because it makes them so much easier to swallow.
Right.
Are you some sort of inspector?
Not quite.
Oh. Well, what can I do for you?
Well, I'm hearing about your friend Tommy.
Oh, yes.
It's a rather delicate matter.
Oh, goody. Oh, well, don't mind me. I'm very broad-minded. Do take a seat. Well, come on. Out with it. And don't spare my blushes.
OK, why don't you pros listen to me? Right, I'm the most learned doctor in Leatherbridge and I know best.
Oh, I feel your pain. It must be such a burden having to explain such sophisticated concepts to us peasants.
Who are we bitching about today, children?
Oh, Kev's got the ump.
With justification. According to the BMJ, there's an alarmingly high rate of burnout amongst GPs these days.
I won't put Kevin in that category yet.
Yeah, apparently 46% of GPs are suffering from emotional exhaustion. 42% feel depersonalised, and worst of all, a third, that's 33.3%, don't believe they're doing anything for their patients.
Oh, maybe that's because they're leaving it to all the nurses.
Well, come on, please, with the greatest of respect.
Oh, here we go.
You lot are just mopping, jabbing and giving out hugs, aren't you?
Yeah, whereas you're just referring anything serious to consultants.
Yeah, do you even know the acronyms? CCG, QOF, CQC.
Clinical Commissioning Group.
Quality Outcomes Framework.
Care and Quality Commission.
Well, at least you haven't got to worry your pretty little heads about what they actually mean.
What a twonk.
Oh, you know, that's twice in one lunchtime, that. I'm getting sick of this.
And, men of a certain age find it hard to find the stimulus, especially under pressure.
Not quite sure I follow you. Could you be more specific?
Well, you know.
No.
I'm talking about...
Yes?
Sex.
Are you saying I'm a nymphomaniac? An unattractive nymphomaniac?
No, of course not. I mean, you're very...
I know what you're thinking. A woman of my age having any sort of urges, it's not right. I should behave myself, be passive, doze my way into inevitable oblivion.
No, I didn't say that.
Really? You any idea what it's like living in a place like this mausoleum? The boredom, the endless, senseless routine.
Well, must be very frustrating.
So if I get a chance of happiness, why should I not be allowed to seize it?
Well, not if it's at the expense of Tommy.
What do you know? Thanks to me, Tommy has had more life than he's had for some time.
What do you mean?
Well, none of your business. And if you don't mind me saying so, I think you've outstayed your welcome.
Mr. Charters, your child is in distress for the very good reason that you're in distress. And whilst I fully support a mother's natural instinct to put the health of her child first, I really don't think that giving little Serenity here, a rectal examination, is going to alleviate your fears. It's a lovely name, Serenity.
It's amazing. How do you get them all to nap at the same time?
It's the peaceful environment.
No thanks. I don't want to spoil my appetite.
Speaking of which, shall we grab some lunch?
Well, Ford Bank Gardens seems to have more than its fair share of eccentric characters.
Who do you mean?
Take Norma, for instance.
I'd hardly characterise Norma as an eccentric. She's a troublemaker, always has been.
Are you being a bit harsh?
She's been a disruptive influence since she first came here.
Well, Norma's certainly lively. No wonder she's got high blood pressure.
Interesting.
What?
There's nothing wrong with her blood pressure.
Will this accursed day never end?
Burning out, Al?
It's unbelievable. Absolutely unbelievable.
What is?
The sheer number of rectal examinations I have had to perform today. I swear, if I see one more set of quivering, hairy buttocks, I will spontaneously combust.
Oh, I'm trying really hard not to picture that.
I mean, what is it with the good citizens of Leatherbridge and their nether regions? Is there some loose bowel epidemic sweeping through the land?
You haven't heard, have you?
Heard what?
Looks like we lowly nurses know a little more than the good doctor today.
What are you talking about?
Norma, are you there?
Go away. Oh, are you deaf now? I said go away.
Where's the man from the mill?
Gone, like you should be.
Listen, Norma, I haven't been feeling great recently, so I felt it was good that it hadn't...
Why did you have to bring that man to see me? I thought we had something special between us. Now you've betrayed our intimacy to a stranger.
I'm sorry, Norma, I didn't mean to do that, but the thing is I couldn't keep on
I just
like
don't
that.
want to hear any more. Get
Oh.
out of my sight.
Norma, I don't...
Just
I don't feel
go
very
away.
well.
Oh, just go. Oh, Tommy, what's the matter with you? Oh, Tommy? Oh, I need some help in here. Oh, help! Oh, what's happening to him?
Tommy, what's wrong?
Oh,
Tommy? You're going to be fine, you hear me?
Yes, I need an ambulance. Has he taken something? I need to know now.
I've drugged him.
The address is Ford Bank Gardens.
Typical local press. Crass sensationalism.
What? So the Gazette running an awareness campaign about bowel cancer is a complete waste of time, is it?
Yeah, it is when it whips up hysteria. Well, no wonder half my patients have got the runs.
That is not funny.
It wasn't meant to be.
We are supposed to be health professionals. Accent on the health.
What's the point you're labouring to make?
That we are supposed to be taking care of our patients. If an awareness campaign like this helps to educate people, surely that is a good thing.
Awareness, indeed. It's simply self-promoting guff. Yeah, and the worst thing about these media-driven campaigns is that it wastes our time. Draining valuable resources from the NHS. A patient would be far better to... Whoa, where are you going?
Never mind.
Gee, some people... so touchy. Are you going to eat it?
Please, somebody tell me he's going to be all right.
Will you let them do their job?
Norma, how long have you been dosing Tommy with Zestinol?
Oh, not long, about 3 weeks.
And how long have you been giving him antipsychotics?
5 days, but they're very mild. I doubt they could have caused this.
Oh, so I suppose I'm to blame, am I?
Do you know how irresponsible you've been? Look at him. Look at what you've done.
And I suppose yours are harmless?
They have a calming effect.
Oh.
Why do you need to use them?
Good question. Because she's an out-of-control freak, that's why.
Down.
Pack your bags. You're going to be transferred to another home immediately.
Oh, no, I'm not going anywhere.
Ladies, please, this isn't doing Tommy any good. If you need to argue, take it outside.
Well, hey, man, you got a delivery? Oh, cheers. It's from the Gazette, and it's a big one.
So it is.
I can't imagine what it could be. Is it some equipment? No, it's not okay.
Well, that's something to know. I need to find out.
Hey, I bet your bottom dollar I will.
What's going on?
Paramedics are stabilising. It appears that Tommy's had some kind of a fit.
Oh, Lord, I must see him.
I don't think She really is quite impossible.
The paramedics don't think that Zestinol was the cause of Tommy's condition.
Oh?
Apparently, the antipsychotics weren't as mild as you said. Did you realise they could induce fits?
How do they know that Norma's pills don't have similar side effects?
I'm talking about what you've done here.
I was helping Tommy. He'd become so agitated recently.
How did you give them to Tommy, without him knowing?
Does it really matter now?
How?
It was in the coffee.
The coffee? So Tommy's not the only one?
Mrs. Denby isn't going to like it, you covering up her notices.
Yes, all right. I'm going to work around him.
What's going on? Having a kids' party?
I got the Gazette to send over some of the campaign material.
Okay.
What?
Well, I think that might be
What?
a bit over the top.
I'm saying nothing.
No, we need something eye-catching to highlight an issue that people don't like talking about. It's a silent killer.
I thought that was ovarian cancer.
This isn't your way of getting back at Al.
No. Do you really think I would be that petty? This is serious.
All right, I'm on your side.
Good. Now, shut up and blow.
The police are on their way.
Was it really necessary to call them?
Do you really need to ask that?
You don't understand. It was the residents. They drove me to it.
So they're to blame, are they?
I had to do something about the sex epidemic.
The what?
Have you any idea what it's like to come across a couple of geriatrics coupling? Old people shouldn't be taking their pleasures that way. It's not natural.
Oh, shut up, Rachel. Have you any idea what you've done here? You've committed assault on the people you should be caring for.
Nobody was meant to be harmed. I was using your methods, rules, discipline, order. Remember?
When did I teach you it was permissible to drug people without their consent?
It was an appropriate response to an increasingly chaotic situation. You saw for yourself what was going on. I had to take control for the sake of the home, my reputation.
Oh, and finally we get to it. This is all about you, is it?
Howard, please.
Well, your reputation's shot, love. Try getting up the next run of the ladder with a criminal record.
Stop it.
And quite frankly, as a mentor, I've failed miserably.
Stop it.
You're dangerous, Rachel. And what's more, a little sad.
Oh, Kevin, what do you think? Oh, well, thanks, Mandy. That's really going to raise awareness for our patients. We'll show him great initiative. What a team player.
Can I have a word?
What about?
Well, for one thing, you've been avoiding me all day.
I've been busy, I still am. Miss Watkins.
Is this about yesterday?
No, just drop it, will you? If you'd like to come round.
Thank you for sorting things out for me.
My pleasure. Take care.
Tommy, when I've sorted out my little bit of bother, you sure you wouldn't want me to come with you?
I'm sure.
Oh, what I said earlier about breaking
Norma,
up was...
You're a very lively lady, and one day you'll make some old bloke very happy. Thank heavens, it's never going to be me.
What do you think?
What do I think? Well, I think it's going to be extremely effective.
Yeah.
Yeah, in getting hysterics and hypochondriacs coming through our door in droves.
Why can't you take this seriously? Bowel cancer is a killer. People need to know what to look for.
Yeah, and it's going to get harder to diagnose when we get swamped with patients claiming to have all the symptoms. That's what campaigns do.
You're wrong.
Says the genius nurse.
This is going to encourage people to go and talk to the doctor about things that they'd normally feel embarrassed about.
Yeah, the wrong people. Well, this so-called information isn't even targeted at the right age group. I've had mothers bringing in toddlers with routine tummy upsets thinking they've got bowel cancer. It's ridiculous.
Yeah, well, if it saves one life, it'll be worthwhile.
Oh, hearken to the crusader. You know what I'm thinking of doing? I'm thinking of starting my own campaign. A campaign against campaigns. And this nonsense is going to be first on my hit list.
Plus, a lot of local professionals are donating their time, so it's an excellent networking opportunity.
Forget about making people better. We're all filling out forms or on missions in the community.
You and your bowels. Just give me 5 minutes and then come through.
She fancies you.
Shut up.
Opposites attract.
I'm not interested.
Normally, I would not speak ill of one of our doctors.
It's a good job I'm here then, isn't it?